Thank you. I feel terrible. They're all going to have respiratory problems tomorrow because they're talking and not breathing at the same time.
Got it in.
We'll come back and get some more of the more information on psychosocial as the audience interacts with you. I'm going to move on to Dr. Lynn Coulter-Schneider, who is in private practice in sexuality counseling therapy in Flanders, New Jersey, and who's kind enough to agree to be with us this evening to talk about sexuality and cancer survivorship. Let's welcome Dr. Coulter-Schneider.
Dr. Landworth. I feel like it's going to be a broken record because I'm just going to be building. I'm not tall enough.
Your mouth has to be really.
Can't I just grow?
Yeah, just.
That would be so much nicer. I feel like I'm going to be building on what has been said before, because certainly the most important part about dealing with sexuality is being able to communicate. The first thing that Barbara said, her first myth was, we need to feel entitled to speak with our healthcare professionals about our concerns. That means that you have to feel comfortable talking about sex, and your healthcare professional has to be comfortable talking about sex back with you. If you remember when you were growing up, you learned head, shoulders, knees, and toes. Head, shoulders, nothing in between knees and toes. So you haven't been given the tools to talk about breasts and vaginas and penises and ovaries and uteri and all of those, and clitoris and all of those hormones that go along with it. And so you don't have the tools. And let me be honest with you, neither do your clinicians. So this topic is a phenomenal topic to include in a speech about survivorship, because it's such an integral component about how you see yourself and about how you feel as a survivor, and yet it is one that is absolutely ignored as easily as it can be, unless you really hammer down and say, okay, what's the deal? Sex hurts, or am I ever going to be able to have sex again, or can you give me something to help me? It's really something that, for the most part, you're going to have to advocate for. And quite honestly, most of us don't have those skills. We don't have the words, we don't have the nerve to talk about it, and sometimes we get the feeling that we should be so glad that we're still here and that we're getting through every day. Don't worry about sex. That's something that you can deal with down the road. I totally disagree with that attitude. The other part to remember is that the day before you got the diagnosis of cancer, your sex life might not have been perfect. It might not have been great, and you might have had a lot of sexuality concerns. So going into the diagnosis and the treatment and the survivorship doesn't mean that it's ever going to be better. You're coming into it with that same group of problems and concerns and beliefs that you had beforehand. So you need to be able to start looking at what are your expectations and are they realistic? Asking your healthcare professional, you're coming into this situation with your own background, with your ethnicity, with your religion, with your age, with your life experiences. I've had patients come in to me and say, okay, here's my religion, this is what I can and cannot do. Here's my ethnicity, this is what I'm allowed to do. Here's my background, I was an incest survivor, so my partner cannot come at me from behind. And there's a lot of stuff going into it that only you know about, that you have to be able to share with your healthcare providers when you ask your sexuality questions. Now you're going to add a diagnosis and all of that which comes with a diagnosis of cancer and say, okay, I want to be a sexual being again. And how do I do it? And it depends on the kind of cancer. It depends on where the cancer it depends on what kind of treatment you have, and each person is going to respond differently. There are some givens. Fatigue is a given. Pain, bruising, fragility, musculoskeletal aches and pains, some feelings of disfigurement, weight loss, weight gain, nausea, stomach problems. Why would you want to have sex if you're dealing with all of these things? It's really not on the top of your list. But that doesn't mean that you still can't be a sexual being. You may not want to have hanging from the chandelier sexual intercourse, but you still want to be touched, and you still want to be held, and you still want to be kissed, and you still want to be touched, and you still want to touch. And so that's really where I want to start, is helping you to redefine what does being a sexual being mean at different stages, and to make sure that your needs are being met by recognizing and figuring out what those needs are at the different times of your progression. Another thing, and this is something that I find very common, especially with breast cancer, is that your body has betrayed you. Sometimes I get, what did I do to deserve this? So if I must have done something so horrible that I've gotten this as a response, how can I possibly think of my body as a source of pleasure and as a source of sexual pleasure? And so, dealing with those kinds of issues must be addressed. This is not a cause and effect. It's not something that you've done. You know that up here, and getting through here can take a little bit longer. The alterations to your body image, you look at any magazine and it has that perfect image of the perfect person. And the reality is, before your diagnosis, you probably weren't that perfect person. And after your diagnosis, you're still not that perfect person. And that perfect person probably isn't having the great sex life that you think they are, and probably has an awful lot of body image issues that you don't even realize. So the body image, you just have to accept, this is who I am, and I can still accept pleasure from this body. I just have to make peace with this being my body now. And then let's look at some of the solutions. I want to bring this in and give you something that you can work with. First and foremost, figure out the words. If it means standing in front of your bathroom mirror and saying, my vagina is dry, my vagina is dry, 5 times until you can get the words out without getting embarrassed and upset, then that's what it takes. If you need to write the questions down and bring them to your doctor and say, these are my concerns, can you address them? But you have to be able to open up the dialogue and figure out what questions you have. Is this normal? Do most people go through these symptoms? What can we do as a solution? I don't have to go through life without having an erection. I don't have to go through life with having a dry vagina because of the medication that I'm on, or because I'm now in menopause because of the treatment. There are solutions for most of the problems. They may not be ideal, but there are solutions. You have to be able to talk with your partner. And believe it or not, it may be easier to talk with your clinician than with your partner, because again, you may not have gone into this having a great relationship and talking often about sex with your partner. Most people get to a point in their lives where, you do this, your partner does this, you do this, your partner does this, you do this, your partner does this, you're done. It's 5 minutes, it's over. The kids are going to be home, and you've made it within that window of opportunity. They're not going to know, they're not going to wake up, they're still watching the cartoons downstairs, whatever it might be. So you've got it down to a pretty good science. And so now, those same moves aren't going to work anymore. Maybe you have to learn how to reposition yourself. And instead of looking at this as a horrible, frightening event, make it fun. You're looking for a new position, that can be fun. It doesn't have to be, I liked the old position. Well, try a new position. It may be thinking outside of the box. Try a new time. If you're exhausted by 4 o'clock in the afternoon, then having intercourse at 7:30 at night isn't going to be the ideal time to have intercourse. Maybe if you're up at 5 o'clock in the morning because you don't sleep well anymore, maybe 5:30 in the morning is a better time. Or maybe you find one day a week where you can get together and lay down in the middle of the day and have lunch or have a nap or have some quiet, intimate time at that point. So you want to really look at not just what are the medications that you can take or that your doctor can prescribe or that you could get over the counter, but how can you change the way you see your sex life, and how can you fit a sex life back into this new form and lifestyle that you're leading. One thing that I always do want to talk about is you do want to ask your doctor, are there sexual effects from the medicines that you're taking? And I'm not just talking about the medications for cancer. I'm talking a lot, as you mentioned, a lot of people are on antidepressants and anxiolytics and maybe a lot of other prescription medications, some herbal medications. Many of the medications can have sexual side effects. So you want to find out if you're on antidepressants. Some antidepressants can have sexual side effects. They can lower your desire. They can increase your length of having an erection. They can decrease your length of having an erection. They can impede your ability to have an erection. So you want to find out if there are sexual side effects to the regular medicines and to the herbal medicines that you're taking. You may also want to, if you know that sex is exhausting or it's painful, pre-medicate. Take Tylenol or Advil. I have one friend who said, oh, Lynn, if you can say one thing, I take Advil beforehand because I know that I can get really achy. And so this way I know that I have it on board and it's not going to be as bad. And so I don't look at sex with, oh, God, it's going to hurt. Can it get over with quickly? She can sit back and enjoy it that much more. Listen to what your partner wants. You may be feeling really guilty that you're not as active as you think your partner wants you to be, and your partner may not be feeling that in the least. So you really need to find the tools to talk with your partner. It may mean going to a specialist. It may mean talking with your clinician, going to a social worker, going to a sex therapist. But find someone who you can talk about these issues with, who has the comfort and the expertise in dealing with it. You're not going to be spontaneous. Anybody who has children pretty much understands that spontaneity is something that you know when you're 19. And anytime you've had children, it's now something that for the most part until if there is ever an empty nest syndrome, until you're at that empty nest stage, spontaneity is a thing of the past. So you have to be able, I have 3 teenage children, it's probably understandable at this point. You have to recognize that spontaneity is no longer the way to be sexual. You're going to have to plan. That's not wrong. There's nothing wrong with that. As a matter of fact, it's very good because you plan based on when you are most comfortable, when you are most energetic, when you are most relaxed, and when you're most likely to be able to enjoy being alone with your partner. And then finally, find positions or behaviors that work for you. You got in a habit of having sex in one way, and that way may not work. You may not have the arm strength. You may not have the comfort of laying on your side. Find different positions. Enjoy finding different positions. If you need to there are a lot of sex ed, not porn movies, but sex ed videos that are out there. Not that I know of that are specific to cancer survivors, but there's a lot. Look in the back of Cosmo magazine or Playboy magazine. They always have some really good sex ed videos. And look at the different positions and try them. It's not going to work the first time, but there's nothing wrong with that. You're still touching. You're still having fun. You're still being intimate. And have realistic expectations. Don't get frustrated the first time and say, my sex life is now over. It's something that you're going to work back towards. It's something that you can keep enjoying. Make sure that you touch every single day. Make sure that you have intimacy every single day. Even if you're exhausted and fatigued and nauseated, you still want to have that human contact every day. And it's just a matter of redefining what you think of as being sexual.